Good evening, and thank you for joining us. We're going to begin tonight with breaking news, and it is sobering. Tonight, more than 10,000 people have been killed by the coronavirus here in the U.S., and experts say we should brace for things to get even worse before the week is over. The toll of the virus is hard to fathom. Nearly half of the deaths in the U.S. are in New York, where space to store the bodies of victims is running out. New York City is now considering temporarily burying them until the crisis is over. There is also breaking news tonight out of London, where the British Prime Minister Boris Johnson, who has the virus, has just been moved to the ICU. Worldwide, there are more than 1,331,000 confirmed cases, and about a quarter of those are right here in the U.S. Tonight, there are some signs the outbreak may be leveling off in the epicenter, New York State. But the governor there says even if the curve is flattening, hospitals are stretched thin, and he cautioned people not to let their guard or stop social distancing. There's a lot to get to, and our team has every angle covered. Mola Lenghi leads off our coverage tonight in New York City. Mola?
Well, there are some signs of hope, but as you mentioned, we are still expecting a very difficult and a very quickly developing week ahead. One example of that, the naval ship Comfort. It was brought here to treat non-coronavirus patients. This afternoon, President Trump approved this medical ship to begin accepting coronavirus patients who are brought here. This as the hotspots nationwide intensify.
New York City's Javits Convention Center is now a 2,500-bed medical facility treating COVID-19 patients. Air Force Reserve Brigadier General Stacy Skaisbrick says more than 120 military medical personnel from across the country deployed to New York City within the past 48 hours.
We're mobilizing in the same way that we mobilize to go to war. We're getting people where they need to be to fight this virus. So it's just like fighting any other enemy.
At an overwhelmed hospital in Brooklyn, these nurses are wearing homemade protection over their scrubs.
It is about the fact.
ICU nurse Shelly Kelly is on the front lines at the Field Hospital in Central Park. After a grueling 12-hour shift this weekend, she shared some sobering thoughts.
I'm kind of feeling like nothing I can do is enough for these patients here. At one point, we had 8 ambulances lined up at the hospital to drop patients off.
But there are small, hopeful signs. The University of Washington has reduced its projected number of fatalities from more than 93,000 to less than 82,000. New York Governor Andrew Cuomo says the death rate has remained flat for the past 2 days. Still, he had a stern warning for those who are flocking outdoors.
We underestimate this virus at our own peril. Now is not the time to slack off.
Other hot zones in the midst of their own battles include Detroit, where cases have tripled in the last 9 days to more than 5,000. Chicago is approaching 5,000 cases. The next hotspots include Miami and Philadelphia. In Louisiana, COVID-19 cases have more than doubled since last Wednesday. Dr. Angela Cornelius is serving in New Orleans, part of a 7-member volunteer team from Shreveport.
You know, there are people dying in our units that their family can't be here with them. And so it's
difficult, I imagine.
It's difficult. It's very difficult.
The virus claimed the lives of 28 residents at this rehab center in Henrico County, Virginia. 88 additional residents have tested positive and are receiving treatment. But there are some bright spots. On Saturday at a Staten Island hospital, it was a tender moment when 47-year-old Christina Paz, a mother of 5, was discharged after a 15-day battle with COVID-19 and reunited with her husband.
Well, the coroner in Jefferson Parish, just outside of New Orleans, tells me that they're running out of room. They've started storing bodies in a refrigerator truck, and they're actually waiting on at least 2 to 3 more trucks to be delivered. Of course, as we know, that's something that hospitals here in New York City have also resorted to, Nora.
Mola, thank you.